All right. Sorry about that. Jenna, can you ask your question again?
Sure. So, Dua, my controversial question is, how come in Canada, for adults in particular, why do we not have a national vaccination program? Or as an adult, when you're a kid, you have a little vaccine passport and you kind of tick off as you reach each age. But for
Hmm.
adults, it gets real murky. So, what are your thoughts?
I mean, I like to send that question to the government and see, because I feel, we have great healthcare, free healthcare, but um, I honestly believe that prevention is the key. It's not just treatment, it's prevention. And so with our child vaccinations, they're usually all covered by the government. You reach a certain age, you're done your high school or whatever age it is per vaccine, and it's no longer covered. And so I feel that is something that plays a role in it. Also, with children, they're too young to have, consent as to if they want to be vaccinated or not, whereas adults have all this information, have all their opinions, and might not want to be vaccinated. So it's sort of like an adult choice, unfortunately. But that's the case. And so, in my opinion, I just feel vaccinations are something that the government does need to do more in terms of coverage and protection. It'll definitely encourage people, especially our senior population. They come up with this great vaccine for RSV. It costs just under $300. These are retired people that don't really have a stable income, and so it's hard for them to make that decision, unfortunately.
I think it's excluding people because of the price.
Right. Yeah, exactly.
Yeah, and
And so,
then
oh,
I was
go
gonna
ahead.
say even physicians might be hesitant to recommend it to people if they feel that, money is a problem for their patient.
Hmm. Exactly. Yeah, that might be another thing. I myself, when I'm making recommendations, I always have to keep in mind, what this person's economic background is, but we never assume. So some people's priorities are, it's $300, but I'm high risk and I do want this. So we never assume that they won't be vaccinated, and we just get the information and it's up to them in the end.
So in our session today, we were talking about ways you, as a person, individual, you could kind of track your own vaccines with provincial. So in BC, we have Health Gateway. So if someone's kind of out there trying to navigate vaccines themselves, I think our number one thing we're saying is go talk to your pharmacist, because they're the expert and can help guide you. But are there any other resources, places people can go to kind of see based on their conditions, what are the recommended vaccines?
So, our government websites are actually very helpful. I am on the 2.gov.bc.ca, and they do have like a list of vaccines according to age. And so people just use that reference as well. Check with your physician, speak with your nurse. A lot of people see, respirologist, and they might be seeing pulmonary therapist, for example, respiratory therapist. These are all people that do have this information. They might just not have the time to discuss it at each appointment. And so that's where our role comes in as pharmacists, as other healthcare providers just simply don't have the time. And so we need to make sure that, where corners are being cut in other areas, that we're doing our part and making that recommendation.
And like you were saying, when we started our chat into, is that pharmacists are probably the most accessible healthcare provider out there.
Yeah, yeah. No appointment needed. Just go ask.
Yeah. And so just for a quick recap, do you mind just even listing off the vaccines, especially the respiratory vaccines that adults should get, especially those living with chronic lung conditions?
So absolutely the yearly flu shot, because it is always changing. Our COVID vaccines are also evolving, and so we do need to stay on top of COVID doses. Pneumonia vaccines, there is the government-funded Pneumovax 23 for those that can afford the Prevnar if they don't have any insurance. Prevnar 20 right now. Those that have had the Prevnar 13 can upgrade to Prevnar 20 after 1 year just to get more coverage. as well as the RSV vaccine that's just come out this end of September, I believe it was. So those are all viruses and bacteria that can affect your respiratory system. And we did also discuss whooping cough, which is needed at least just once in adulthood. So it's important for people to make sure that they're updated on that one as well.
Perfect. Oh, and we talked about RSV too.
And shingles. Yeah, we did speak about shingles after age of 50. That's one that I would be asking our pharmacist about as well.
And then for all our gardeners out there, we briefly talked about the tetanus.
Tetanus, yeah, tetanus with the whooping cough. So the whooping cough vaccine doesn't come on its own; it's always in combination with tetanus. And the tetanus vaccine does need to be done every 10 years.
I know it's tetanus, diphtheria. Is diphtheria its own disease?
It's something, yeah, it's on its own. So tetanus, diphtheria, and then pertussis. That's the whooping cough portion.
Thank you. Wow, I can't thank you enough for all of the information that you've given us. I don't know if you could hear me.
Just dumped it.
But yeah, I'm like, ooh, 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 and I'm just typing up a storm, trying to download your brain.
But thank you for having me. This was a great experience, and I really did enjoy it.